Integrated trauma treatment, prolonged exposure therapy, art therapy, and Christian worldview. Brittany Teague, presentation, Liberty University. Cognitive behavioral therapy, prolonged exposure therapy, and art therapy can be integrated to treat PTSD. This can be effective because CBT can often be verbally based. The integration of art therapy allows for the examination of nonverbal treatment. This is important because of the way trauma affects the brain. Traumatic experiences can result in changes in the brain chemistry. The senses experience a traumatic event. This is translated to the thalamus and onto the amygdala. These memories are processed in a stressful way that affects how the memory is stored. All of the senses are stored in the traumatic event and may be recalled non-verbally when triggered. The amygdala is responsible for detecting danger. The amygdala perceives sensations as non-threat or threat. A threat is when someone feels that they can't escape or feels helpless and out of control. Vision, smell, taste, touch, and sound. These sensations pass through the thalamus to the amygdala and are stored as a memory according to if it is a threat or non-threat. Messages are sent between neurons. At the end of the neuron is a presynaptic and postsynaptic neuron. If a threat is detected, an AMPA receptor is released and binds to the neuron. When a similar situation is experienced, there is an automatic emotional response. A trigger causes an automatic response. This response is immediate and emotional, connect to a memory that is not processed in the frontal lobe. It is instinctive and uncontrollable. Any similar event can cause the neurons to fire and cause a response by the subconscious mind. This stays permanently attached to the neuron, causing a fight, flight, or freeze response. When there is any stimuli that touches that instinct, someone may not even realize why they are reacting to the stimuli. CBT. There must be removal of the AMPA receptor so that the emotion or sensation is no longer determined to be life-threatening. Prolonged exposure therapy addresses PTSD memories, which are intrusive thoughts, nightmares, avoidance, and flashbacks. 4 elements of PE are education, breathing, imaginal exposure, and in vivo exposure, and homework assignments. Art therapy works when there is a shutdown with the Broca area, or speech area of the brain. Art allows reintegrating the right and left hemispheres of the brain, which helps with communication or finding words. PE starts with education. Session 1, Education. Understanding the PE process. Understand trauma. Discuss traumatic events. Learn breathing techniques. Retraining. Homework video review. And the session lasts 60 to 90 minutes. The client needs to be familiar with what the PE process is, as well as what trauma does to the brain. This will encompass a large part of the first session. This will also be the time that I will explore the client's trauma and level of awareness. It is important to realize that many clients will attempt to avoid and resist. They will need to learn breathing techniques and retraining. By replaying the video of the session will take from 60 to 90 minutes. Breathe. Teach breathing techniques. Teach why breathing is important. Take the session for them to revisit and practice breathing. Breathing is very important for PE to be effective. How we breathe affects our feelings. When we experienced trauma, our breathing was shorter and quicker to fuel our body. PTSD is like living in that mode. With breathing techniques introduced, a person can feel less alert or exhausted. The person should learn to consciously practice breathing slower. It doesn't have to be deep breathing, just smooth, calm breathing. They should breathe through their nose with their mouth closed and exhale slowly with their mouth closed. They should say the word that relaxes them as they exhale. I would do the exercise with them, record it, and allow them to revisit the technique by listening to the recording to help them learn to breathe. Session 2. Clients talk in detail discussing events, emotions, or activities and the responses to them. In vivo education is reinforced. Develop a list for confrontation by client. Breathing techniques are reviewed. This is a very interactive session. This would be a time to ask what memory haunts the client the most. In vivo exposure will begin here. The client should start a list of triggers. We would construct a list of activities or situations that have been avoided. This will allow for in vivo exposure activities before the next session. It should be small situations which are safe and gently approached. Session 3. Increased difficulty as we start with homework review. Introduction of imaginal exposure. Experience the trauma through discussion for 45 to 60 minutes. 15 to 20 minutes discussion and processing. Listen to the video each day and continue in vivo exposure. Integration of art therapy. Introduction after Session 3. Art therapy bypasses the area of the brain where trauma is encoded and allows for expression without words. After Session 3 would be the time to introduce art therapy. The client is experiencing emotions and trauma at new levels by Session 3. They will need to continue with PE therapy, but art therapy will give them an outlet if they are having trouble verbalizing what they are feeling. In addition to, not in place of. It is very important that art therapy is in addition to and not a replacement for exposure homework. Art therapy is psychotherapy. It allows the client to silently express what they are feeling when words are difficult to find. They can use symbols in art form to help them feel emotions, then hopefully be able to better verbalize during session. This is also a time that reflection can be used and taught. Discussion of art would help facilitate discussion during the sessions. Emotions and feelings could be discussed and how the art reflects what the client is experiencing. Sessions 4 through 9. The foundation has been put into place with the previous 3 weeks. The final sessions can be intense, but that is required for prolonged exposure to be successful. Graduation. The final sessions will be reviewing and recounting the trauma while preparing for graduation. History. Edna Foa started exploring this concept before PTSD was included in the DSM. She was studying methods to assist with anxiety and phobias in the 1970s. The first observations were with Vietnam vets, then rape and abused women. Edna Foa started exploring ways to treat people with phobias and anxiety in the early 1970s. PTSD was not in the DSM-3 until the 1990s. She wanted to know why trauma caused flashbacks and nightmares when happy memories did not. She observed exposure therapy for Vietnam veterans and realized that what they were doing in the therapy was not intense or long enough, hence the name prolonged exposure was applied. She later started using the therapy with women who had been raped or badly abused. The results were such that no one was worse after treatment, and many were better. She also realized that avoidance was an issue as many people couldn't continue the therapy. The addition of breathing techniques and education helped the retention. However, due to the intense nature, there is still the possibility of dropout. Art therapy may help with this. It may offer an extra element to PE which would assist a person to stop avoiding and continue treatment. Integration of art therapy would need to be something provided only after the therapist has assessed that it could be beneficial. It will take a counselor intentionally learning about art therapy and being very cognizant of the client's needs. What does prolonged exposure therapy, art therapy, look like when integrated? There were many names for PTSD in the past. Shell shock, soldier's heart, combat fatigue, or war neurosis were a few. Jimmy Stewart, a famous actor in the mid-1900s, came home from the war with the label of Flak Happy. What did PTSD look like years ago? An example of this was with the actor Jimmy Stewart after he returned as a fighter pilot in World War II. Here he is pictured just 2 years apart. He lost 130 pounds when he returned from war. This time of year, I start watching Christmas movies. One that has always stood out is It's a Wonderful Life with Jimmy Stewart. I just recently found out that Jimmy Stewart returned from World War II with PTSD. His diagnosis would have been, had there been a DSM-5, with post-traumatic stress disorder 309.81 with the F code 43.10. He met all the criteria. He had directly experienced traumatic events. He met all of B, C, most of D, F, G, and H. When Jimmy Stewart returned, he had lost 130 pounds, didn't sleep, and was depressed. He had survivor's remorse and was called Flak Happy. He never spoke about his emotions or what he was experiencing. Although he was famous before the war, offers didn't come in after he returned. His extreme change in appearance and personality affected his offers. When he was offered It's a Wonderful Life, he had to take it because there was nothing else being offered. He wanted to refuse the job because he didn't have suicidal ideation, and the movie required him to depict wanting to commit suicide. His manager told him to take the job. Little did he know it would be the therapy, maybe even a type of prolonged exposure therapy and art. Not formal PE or art therapy, but Stewart was forced to relive his PTSD and emotions on the screen. His acting was an art form. Although Stewart didn't seek help or talk about the war, he was a method actor and drew from his experiences while on the set. He was required to explore his emotions and feelings for long periods of time while filming. The filming took 90 days on the set. Many of the scenes took many tries. He would have to feel destitute, useless, helpless, depressed, and suicidal. Except for suicidal ideation, these were all emotions he knew well. Many of the actors on set stated that the scenes were uncomfortable and intense. After the filming was completed, he had to review the emotions in depth as he had to do the voiceovers. He created a mask and displayed his feelings for everyone to see. How would prolonged exposure and art therapy have worked with Mr. Stewart? What would prolonged exposure and art therapy look like if Jimmy Stewart were being treated today? First thing would require Mr. Stewart learn why treatment could be beneficial. He held everything in and didn't allow anyone to help him. Today there is hopefully less stigma attached and he would request help. Unfortunately, there are still soldiers unwilling to admit the need for help. He would learn how the brain is affected by trauma. This is information that has only recently been discovered. He would then be taught breathing retraining technique. This is something method actors are familiar with. They had to learn speaking and breathing techniques while acting. Finally, there would be videos of the sessions so that he could review them. He would have been given homework. Because he was acting, he had homework and information gathering while learning his lines and drawing on his emotions he would need to act in the upcoming scenes. The second week of therapy would have had a self-report skills of his PTSD. There would be exploration of in vivo exposure. Mr. Stewart didn't have to tell of his specific traumatic experiences, but he had to face the demons in his own mind as he was triggered, while having to act out his depression and desperation. This was recorded and replayed for him to see in art form. In an intermediate sessions, he would have audio tapes of the sessions and imaginal exposure response. He would have to spend 30 to 45 minutes of imaginal exposure. This means that he would have to name his trauma. Trauma wasn't a term, but he had to name his emotion they would be filming. This was a primitive form of imaginal exposure homework. He would then have in vivo exposure homework. All of this would be recorded. Mr. Stewart continued for 12.5 weeks displaying his hotspots on film. In the final weeks, I would have Mr. Stewart review all that he had done over the last 11 weeks. He would need to share how he had changed and progressed. He would finally be able to say goodbye and move on with his life. This is like what actually happened. He was able to express himself as an artist. He didn't use paint or clay, but he translated part of his life onto a screen. He had to review every detail at the end of the filming process when he did the voiceover. This is similar to processing the imaginal exposure. One thing he didn't do was process what he had experienced. That would be an exercise I would do with him. However, he did seem to process it and stop avoiding his loved ones. He even embraced his military life and didn't begrudge what he had done. By the end of filming, he seemed to have a lowered distress level and shift negative responses to positive or neutral responses. He went on to have a successful life. Christian worldview. The final part of the movie depicted George Bailey's request for God to help. Both prolonged exposure therapy and art therapy are conducive to a Christian worldview. I never work with anyone before I pray about what the Lord wants me to do, say, or think. I am completely dependent on Jesus Christ for all that I do. Lean on, trust in, and be confident in the Lord with all your heart and mind, and do not rely on your own insight or understanding. In all your ways, know, recognize, and acknowledge Him, and He will direct and make straight and plain your paths. Proverbs 3:5-6. Jesus is the perfect example for any job. This is especially true with counseling. In following His example, I would strive to be compassionate and accepting. He gave everyone worth. I want to believe that there is a place and purpose for everyone in this world. He met needs. Not only did He meet needs, He had the ability to see what they needed. According to Wright in 2011, He used the right words and emphasized right behavior. He was hope and an encourager. He also encouraged people to accept responsibility. He offered peace of mind and met people where they were. He was holy and obedient to God. There is no way to write about all of His attributes. I will never measure up to Him, but I will always strive to be Christ-like.